Hello, I'm Ira Bedzow, and this is The Good Life, a show that talks about all aspects of human flourishing, from physical and mental health to social and spiritual well-being. I want to thank our sponsors for the show, the Restoring Religious Freedom Project at Emory University School of Law, and Shlomo's Restaurant at the base of Aspen Mountain. The topic of today's show is the relationship between public and private health, and I will be speaking with Karen Koenemann, who is the Public Health Director for Pitkin County Public Health. Before we begin discussing what public health is and how it relates to the healthcare system, let's break down the issue and give some background to set the stage. Usually, when public health is discussed in the news, it's usually about natural disasters or national emergencies such as hurricane relief efforts or the opioid crisis. But besides hearing about these big events, we often don't hear about public health initiatives or know how they help us every day. Public health organizations and officials work to keep Americans healthy and safe. From tracking disease outbreaks to preventing injuries, from promoting laws to reduce secondhand smoke, to pushing education programs that get kids to exercise, public health officials try to get at the social and environmental reasons for why people get sick so that we can all live healthier lives. This is an enormous task where people from all levels of government need to coordinate with each other and with people outside of government working on everything from grand-scale projects to very local programs. It is an aspect of healthcare that many people rarely think about, but on which all of us are heavily dependent, both individually and as members of various communities. With this setting of the stage, let's hear how a leader in public health is working to implement these public health programs in Pitkin County. Karen, welcome.
Thank you.
So before we talk about public and private health, it may be helpful to define our terms a little bit. What exactly is public health?
Sure. Well, first of all, you did a really good job at synopsizing public health right there. So I think thinking about public health in relation to, as you mentioned, we hear about it when it becomes an emergency, and we often think about public health as a silent partner in the community. And when we're fortunate enough to travel to other countries and we see the effects of a poor public health system, so for example, traveling in India last year in February, arriving in Deli, which is one of the most polluted cities in the world, and not being able to really breathe the air, feeling that burning sensation in your throat, seeing waste and sewage in the streets, not seeing a good public health system where people are getting the vaccine preventable immunizations that they need, I think illustrates where when there's a poor public health system, you see the effects of it. But when there's a good public health system like we have in the United States, we don't see the effects of it because it's behind the scenes working every day to ensure that disease isn't being passed on from person to person. So I can talk a little bit more about what public health is, but I think just thinking about it in context of that we are fortunate that we have a good system here in the U.S. and we want to ensure that that system continues to be good.
Well, let me ask you, who sets the agenda for that system? I mean, as a public good, especially in the type of ways we look at healthcare or any types of goods in the United States, we tend to think about it as a market or as a bottom-up type of understanding what the demand is and therefore also the supply.
Sure.
Where in other countries we think more of like a command economy where it would be much more top-down guided.
Right.
But then you have problems with public goods in general of coordination.
Right.
So how does public, where does the agenda where's the agenda set with the public good of public health?
Right, and I am glad that you're capturing the essence of public health is a public good, just like a park or a school system or a library, and it really is a benefit to all. And so the agenda gets set at a variety of different levels. I would say certainly the Centers for Disease Control has a public health agenda, and we follow a lot of sometimes our funding follows a CDC mandate, and sometimes just the work that they're doing, we want to ensure that we're promoting that kind of work. So when we think about epidemiology or disease containment or emergency preparedness and response, a lot of that direction comes from the Centers for Disease Control. We also have a state health department, and the state health department has certain core functions that there was a Public Health Act passed in 2008, and as a part of that Public Health Act, the state health department said, these are the core functions that you will do as a county-run public health system. And then, so we have a little bit of top-down approach with that, and as a governmental system providing a public good, we want to ensure that we're also hearing from the constituents that are really the taxpayers that are funding our work. So we want to be financially responsible to the taxpayers, and we want to be able to hear from our community and to know what is important to them. So I think there's sort of a bottom-up approach to the work that we're trying to do as well, that we really engage our community in an authentic way and hear from them what they think is important and meet their needs as well. So I think there's kind of two things that are coming at us: a top-down mandated services that we want to ensure are happening, and then also a grassroots approach to ask our community, what are the health concerns, and how do we meet those health concerns?
Well, no, that's really interesting, because it seems to me like a lot of times when we think about public health, we think about, you know, medicine or health is like really like physiological and so forth. But it also seems like public health has a lot to do with public safety at the same time. But those things are seemingly very distinct, both socially and even conceptually. How do you bridge the gap of public safety versus public health?
Sure. And I think we look at public safety and public health, and then also healthcare and individual health. So there's sort of three different pieces with that. And so when we look at emergency preparedness and response, we're looking at the public health response to an emergency. So certainly we have other partners that are addressing emergencies as well, but we want to think about what are the public health components to that emergency. So if there was a wildfire, we want to be looking at what's the air quality concern for people. We might be looking at if people were moved from their homes, you know, what kind of septic systems do we have, or what kind of sanitary systems do we have to ensure that people are getting, that they have access to safe water and safe other things with septic systems or septic issues or sanitary issues. So there's the safety component to that, and I think that we're aligned with the public safety across looking with our partners around that. And then with the public health component in relation to individual health and health care, really public health is looking at population-based health or community-based health. So we're looking at, when we think about public health in Pitkin County, we're looking at the whole population of Pitkin County. And so we really want to ensure that disease isn't spreading in the whole population. And so if we think about things like immunizations or vaccine preventable diseases that we want to make sure aren't being passed through the population, and then things like air quality, we want to ensure that we're monitoring our air, and we're ensuring that we have regulations that enforce clean air. And so we're thinking about, the whole population's health in relation to those things. And you know, air and disease don't look at jurisdictional boundaries. So we have to think about beyond just our county boundaries, even though that's our mandate to serve.
No, look, so I hear you, and I want to get to the individual health and population health in a sec, but I want to kind of take this route for a second with regards to looking at public health and public safety. One of the things that, you know, I was always taught is if you have a hammer, you see everything as a nail. So I definitely understand the need to coordinate with other agencies because public health is or the natural and national or even local challenges that we would have are not going to just strictly be with regards to physiological health, but the environmental issues, the economic issues, and so forth. However, do public health organizations try to medicalize or see everything in a health lens to have the both ability and control of intervening? Or does it recognize that sometimes things may not be a health issue, but at the same time, public health should either find the right partners or get involved because it's still an issue that should be broached?
Sure. So I think a lot of public health people think that everything is a health issue. And so when we think about the conditions that we create for society, the social, environmental, and economic conditions, they do play a role in our health. And so the research shows that between the environmental, economic, and social conditions we have, that's 50% of our health outcomes, that genetics plays a smaller role, health behaviors play a smaller role, and actually healthcare plays the smallest role and in our overall health. So, and that's a very public health way of thinking about things. So when we think about those conditions, I think it's important to think about how those influence health overall. So those could be things like transportation or poverty or housing or even social isolation. So yes, I think we try to get as broad as we can and think about all of those factors that do play a role in someone's health. And certainly across the spectrum, we know that those other things play a role too, and we want to have access to health care, and we all want to have access to integrated health care, and there's so many important pieces. But if we're not getting out to those social conditions, we're really not getting at the root cause of why someone might not be healthy to begin with.
And how has public health changed over the past decades? I mean, healthcare in general has become much more complicated. We all know about that. The environments in which we live are much more sophisticated and diverse in terms of anywhere from rural to suburban to urban have specific challenges, yet commonalities, as you said. Epidemiology knows no boundaries as well. But also, I'm sure the focus of public health has changed in the past 50 years as well, from like seatbelts to today. Right. Would you mind talking a little bit about that evolution?
Sure. So when public health really first started, we refer to it as Public Health 1.0, and thinking about when sanitation first came, toilets really became a norm in people's houses, and we didn't have raw sewage going through the streets, and when we started to see vaccines and immunizations as part of public health, and then we really moved into a 2.0 phase where we started looking at policies and environmental systems. So that's when things like tobacco policy came through, and seatbelt policy, and again these broad kind of population-based strategies to really impact health across the population. And now we've moved into a Public Health 3.0 version, and we kind of swing back and forth, I say, between 2.0 and 3.0 right now. And 2.0 still is really crucial. All of the things, seatbelt laws and immunizations and family planning and all of the things that people traditionally think public health does are still really crucial, and especially with the changes in healthcare, we might see public health swinging back to becoming more of a safety net system around those pieces. But public health is really trying to move into this broader conceptual piece around 3.0 and how do we influence or in essence influence those social and environmental and economic conditions of health. So how can we be a chief health strategist in our community? How do we convene the right partners to talk about health issues? How do we work with our partners? How do we assure that our partners have what they need to get their work done? And we might move a little bit away from direct service and ensuring that our partners can do the work that they need to do to provide maybe some of those 2.0 pieces, and that we really convene and move the whole community forward around health.
I don't know if it was intentional or not, but it seems as if public health initiatives, besides solving concrete practical problems, also change the perception of what a community is and what community property is. Like, for example, when you talk about sanitation and sewage in the streets, the reason why sewage was in the streets is because streets were public and therefore owned by no one. So when they're owned by no one takes responsibility for them, and they throw literally sewage in the streets. By seeing how that affects individuals, streets now go from owned by no one to owned by everyone, right? You see the same analogy with secondhand smoke, right? People who at first saw secondhand smoke as not necessarily a community danger, or saw it as, well, air is nothing, it's owned by everyone, or something not to be considered. Until people realize that everyone is affected not only by people's actions, but even indirectly by the consequences of those actions, however far removed, we tend to create greater accountability and responsibility communally over things. So the manner in which public health is solving problems is also changing perceptions at the same time, which is a really exciting way to think about it, because while it's dealing with health, it's also dealing with community and identity at the same time, which is really exciting.
That's I've never heard it put that way, and that's really brilliant, I think. And I do think that public health's origins and its roots actually come from social justice and from looking at that. How do you, and public health and and public planning were intertwined during that Public Health 1.0 phase, and now we've kind of, in 2.0, community development and public health really moved apart, and now we're trying to move back together again. And I think it's for the reasons you just really named, and that we see that we have a role in community development. I mean the built environment, but I also mean how do we play a role in creating a more cohesive community? How do we look at the assets of our community and build upon those? How do we engage voices that we may not always hear from, that are marginalized folks that we really need to be hearing from? They have a valuable voice that I feel like as public health we really need to be capturing and listening to. And so I see our role as a huge community builder, and if we're not playing that role, we're not doing a good job.
No, I think that's is an aspiration that not only we should have, but will allow for further opportunities in health and wellness just in general. So now I want to go back to the private health. And given where Public Health 3.0 is going, what is its current relationship with private health? What is the relationship it should have? And also just explain to me, because a lot of times people might think of public health, they think of Medicare, Medicaid. Like what is the difference between public health and public assistance in private health?
Sure. Well, and I think a good way to, kind of going back to just defining public health and the difference maybe between healthcare and public health is when someone comes in to see their doctor, they're getting individualized care to treat a specific illness usually. And public health, again, really is looking at the whole population and looking at how do we prevent disease from ever happening, how do we protect the whole community from disease if there is a disease spreading. And so we're really on that prevention and population focus. And so thinking about treatment in relation to the individual versus prevention in relation to the population. That's really, I think, the key difference between healthcare and public health. And so if someone comes in because they have a vaccine treatable or vaccine preventable disease, the doctor may really go ahead and treat them for that condition. Public health would have said, boy, it would have been great if we would have gotten folks immunized, and then they wouldn't be sick, and they also wouldn't be getting their neighbors sick. So we really are looking again at that spread of disease through the population. That's very true for diseases that can be spread that way. For things like chronic disease, we definitely have started to take a role in that too, in the prevention of chronic disease. But we're looking at environmental and systems level, policy level strategies. So that could be building a bike trail so that people have access to bike from their home to work to reduce obesity rates. So we're still looking at sort of that broader systems level and broader community level to really address some of those concerns. So policy, environmental systems, those kinds of the environmental conditions or conditions we create to promote health are really the direction that we're trying to go. I don't know if I really answered your question.
No, you did, but it actually brought me to another question, which, this is something I struggle with just in general, but I'd love to hear if it's a conversation that's explicitly being had in public health, or if they're just assumptions that people have and just run with. When you have public health issues in general, you're always going to be butting against two values. The value of the autonomy of the individual to live a life that they want, and the harm that autonomy may create on others. Right? So we look at the difference between positive and negative liberty, where positive liberty is giving people what they need to flourish or to be all the best that they can be. There's also the negative liberty of being free from outside interference, right? Positive liberty gets very dangerous because who am I to say how you should flourish? So we usually go to negative liberty of as long as you don't mess with me, I'll be I'm okay with that. But public health initiatives mess with people because they say you can swing your arm as far as it hits my face.
Right.
But if you hit my face, that's going to be wrong.
Right.
Right? So how does that become balanced when you deal with public health issues,
Yeah.
especially given healthcare today and the public debates in healthcare today?
Right. Well, and I think we see this play out a little bit in things like fluoridation of water or folks that choose to not immunize their children. And so we do see this sort of balance of individual responsibility and individual right.
Especially in preventative medicine is the issue. Yeah.
With the collective good and society's good. And so I do think that there's always kind of a fine balance between that, and especially when we start to think about issues of health inequities, where we look at folks that are suffering from greater inequities in their health, or greater negative health outcomes because of inequities in society. And so inequities can include anything from things of those determinants of health I mentioned, all the way up to we see racism playing a role in people's health, actually, or the isms playing a role in people's health. So I think there's sort of, and when we think about health inequity, it's very society-based. So we're looking at that collective good and looking at the values of the individual responsibility versus the values of collective good or interconnectedness with community.
Right.
I think we have to balance those things. I think we can also create opportunities for people where the healthy choice is the easy choice, right? So we know we all have a role in our own health. We know we all have personal responsibility to take on and think about our own health. How do we still help people to have the healthy choice, the easy choice, right? So there's still things that I think we can play a role in, where we respect that people have individual responsibility, and at the same time we can have societal conditions that help with that. So I think there's a balance. And then just from a personal perspective, I just see the whole world intertwined. I think when we think about ecosystems, you can't just pluck out one piece of the ecosystem. You can't take out the apex species, like a whale, and then expect that everybody else is the whole ecosystem is going to flourish or not flourish. And so I think about us collectively as well in relation to our health. So we can't just pluck out one piece and expect that people are going to flourish in the system, that we really have to have the whole system functioning well together, and that we are all interconnected. We're not individuals, we're a collective society. And so my values land in that public spectrum and kind of in that collective community place, but I also understand and respect when people talk about individual responsibility and kind of the play on that.
So what are some of the biggest challenges or opportunities that Pitkin County has?
Sure. Yeah. So we just went through a community health assessment and identified with our partners, so our neighboring counties, what our biggest health concerns are, and we find, and this is not unique to the state of Colorado or to the nation, but mental health and substance use is a real challenge for folks. And there's a lot of probably different reasons why that is occurring, but we know that that's a huge health concern, and I think we're at a crisis level in the country around mental health. People just not getting all the way from access to care back to prevention kind of pieces. And then we also identified healthy housing as one of our primary concerns, and that includes everything from radon levels in the house or lead levels in the house or water quality, so sort of those environmental factors, to do people have access to affordable, appropriate housing? Can they live where they need to live? Is it appropriate housing for what they need? And then is it affordable?
Well, it's funny. I would guess that given that public health needs buy-in from the public, you'd have different challenges with regards to the implementation of the public health program and the quote-unquote marketing of the public health program and figuring out how to get people aware that it's important.
Sure.
How do you deal with those two aspects of, or two challenges in public health initiatives?
Yeah, so we're a new department underneath the county structure, and this is something we've been thinking a lot about. So we haven't had a lot of presence in the community, and so we believe, first of all, that's an important role we play, and then also how do we better educate? And public health does a horrible job at letting the public know what we do and why we're important to the community. So I believe that is something we need to do better at as a discipline, and then also we have an opportunity here in Pitkin to go ahead and do that because we're new. So that's part of our mandate, and not mandate, but part of what we're thinking about, but we're also trying to balance that with getting the department off the ground and getting our core services that we're required to do off the ground, and then also addressing some of the things I mentioned in our public health needs assessment to really say, how are we addressing, or how are we helping the community, because we may not be addressing it with direct service, but how do we support our partners in addressing healthy housing and mental health and substance use.
Well, Karen, I really want to thank you for coming in today. I think that this is a really important conversation to have, and I'm glad we're starting it here.
Great.
We've reached the part of our show where I recommend a book that can provide greater insight into the topic we've been discussing. This week, I recommend Surgeon General's Warning, How Politics Crippled the Nation's Doctor by Mike Staub. In entertaining and informative detail, Staub recounts the history of public health initiatives in America and how politics has handled and influenced who controls the public health agenda. It also informs readers about the creation and the diminishing role of the Office of the U.S. Surgeon General, a position that many Americans know about, but few Americans know what its responsibilities are. In his book, Staub warns future surgeons general and the general public about the current efficacy of the office and what that may mean for the future of America's doctor in being able to positively influence the health of the nation. For anyone who has an interest in the government's role and interests in promoting national well-being, this book provides a roadmap as well as lays out the obstacles that we face. We close each show with a maxim that we hope will provide a simple takeaway that keeps you mindful of the ideas discussed. This week, the maxim is, as part of a larger community, we benefit from public health and safety. We hope that with this show, you have come a little closer to achieving the good life. Okay, thanks.
Thank you. Yeah.